I am honored to be welcoming back Dr. Alex Terrill for her second annual Post-Acute Care Conference here in Montana. And Dr. Terrill comes to us from the University of Utah, where she is an associate professor at the Department of Occupational and Recreational Therapies. She's a clinical psychologist specializing in rehabilitation. Her research focuses on adjustment to chronic conditions such as stroke and associated disability, in particular as it relates to couples. And we really enjoyed her presentation last year on rehabbing the couple. We enjoyed it so much that I always extend her research project to the patients I talk to at my hospital in Bozeman. And my parents actually just finished her project, and it was really interesting to be a part of it on a personal level. So we look forward to hearing more from Dr. Terrill. So please welcome her to the stage.
Okay, all right. Well, thank you so much again for having me back this year. I did give a presentation last year on rehabbing the couple, where I talked a lot about mental health post-stroke and the importance of addressing that, not just in the patients, but also their partners. So this year, when I came back, I decided to give this a little bit of a different spin and focusing more on the relationship piece and how important those are, not just for the couple, but also looking outside of the couple and things we can do to promote that. As was mentioned, I am neither an occupational therapist nor am I a recreational therapist, but that's my home department. I am a bit of a unicorn in that I'm a clinical rehabilitation psychologist, so I got to check that other box in that poll earlier, which was a lot of fun. There's not a lot of us out there, so. Just as a disclaimer, or my disclosure, is that I have received funding from the National Institutes of Health for the research that I do. For our objectives, we're going to talk about the effects of stroke on couples' relationships, as well as their relationship with others, explain how relationships can be a source of resilience, and then the potential benefits of using a dyadic or couples-based approach. So what's the issue? I was actually really happy to see that the previous presenters this morning that came before me addressed a lot of this already and kind of highlighting how important it is that we think about our patients as well as their family members and caregivers when we think about their recovery, rehabilitation, and reintegration into the community. But just as a sort of a recap and focusing a little bit more on the mental health piece, we do know that this is a really big issue, right? About a third to half of stroke survivors, as well as their partners, experience mental health issues. And that's linked with things like increased disability, increased risk of mortality, stroke recurrence, as well as rehospitalization, and then decreased in functional and motor recovery, decreased participation, and quality of life. So it has this trickle-down effect that's really significant and is something that we should care about as providers. Of course, as was already mentioned, availability and access to mental health support specifically is very limited. So we're coming at this from a little bit of a different angle, and I'll talk a little bit about why we're doing it this way in a minute, but we want to focus on resilience. Resilience is this idea of adapting or thriving in the face of adversity or challenges. Typically when we think about resilience, it's like this bouncing back after a stressor, right? That's the recovery portion. But there's also a sustainability piece to this. It's the capacity to continue forward in the face of adversity when there's more of a chronic stressor. So now we're thinking about patients and their family who are months, maybe even years out, and they're continuously having to sort of redefine their experience, their lives as a result of the stroke. So being able to continue your engagement in valued activities and maintaining that quality of life is also part of that resilience. It's not just that acute bounce back. And there's a lot of research that shows that being more resilient is actually a protective factor from having mental health issues or from letting those mental health issues affect things like quality of life. And this is, of course, where the relationship piece comes in. Relationships can absolutely be a source of resilience. Social support is beneficial for a lot of different outcomes, kind of spanning anywhere from physical to mental well-being, health and well-being. What we know is that stroke survivors, as well as their partners, unfortunately are at risk for reduced social support or lacking that social support altogether. Oftentimes connections kind of tend to drop off or fall off. What we describe sometimes is like there's this big rallying that can happen after someone has had a stroke, like, oh, we're here to jump in and help out. And then as the patient or the survivor starts resuming life as usual, right, reintegrating back into the community, some of those supports tend to fall off, kind of like, oh, well, you're all better now, right? It's time to get back to life as usual, when really nothing is as life as usual. And there's again like a big body of research that shows that consistently things like social isolation, loneliness, and lack of community participation are all associated with higher risk of depression, poor recovery, and lower quality of life. Just as a kind of a differentiator here, social isolation refers to kind of more of a physical isolation, whereas loneliness is this idea that you might be surrounded by people, but you feel like you have no one, right? So there's a difference there, but both of them contribute to this idea of social support. For existing interventions, as far as mental health goes, I hope just in that very brief slide, I managed to convince you, or maybe some of the other speakers before me managed to convince you that mental health is important. It's really common to have mental health issues after stroke, and it has some very, very significant effects down the road that we should care about as healthcare providers. Unfortunately, it's very much under-recognized. We tend to not screen for it. And as a result, it's also under-treated. So we know, for example, that there's some big national studies that have come out where someone might be, or if someone who has had a stroke is identified as being depressed, they have only about a 40% chance of actually being treated for it. So that's not okay, right? We know this has really, really important downstream implications. And also, speaking with stroke survivors themselves, they feel that mental health is not prioritized as part of their rehabilitation. So I'm going to say that we can't all be mental health providers, but we can all be mental health supporters, and we're going to talk a little bit about how that might happen. Kind of getting back to this idea of the relationship and the couple, there's this idea of dyadic interventions which target both the person who had the stroke as well as their caregivers or care partners. And there were several reviews that came out in stroke that showed that, they are really promising, right? We see a lot of benefits, especially for the person who had the stroke, but for the caregivers, it's a little bit more mixed. There's different reasons for why that might be. I'm not going to get into that this time around. I did last year. But there's maybe some other things we need to be thinking about when we're treating that dyad or that couple. And more importantly, the relationship is often completely left out of that equation. So kind of just thinking about, one person or one individual at a time and not really thinking about the interactions that happen. So I'm going to invite all of you to do like what we did in rethinking how we treat our patients and their partners. We had proposed a new intervention model that focused or that kind of moved the needle from the traditional fix what's wrong approach to a building what's strong approach. I'm not suggesting that we shouldn't do what we normally do, which is addressing deficits. But also we can build on resources, right, that can promote this idea of resilience, and that is equally important and can be used in supplementation to some of the other approaches. So these are activities, for example, that emphasize strengths and resources, both in the individual as well as the relationships. And in our case, we target both the patient and their partner. And so Piper, in my introduction, briefly mentioned the RESTORE study as being the project that I introduced last year. This is our intervention. It's a remotely administered dyadic intervention to promote resilience in couples coping with stroke. I'm just going to give a very brief overview, and I'll have a little bit more information at the end in case you all are interested in having this as a resource for your patients or clients. The program is an 8-week intervention. The aim is to promote resilience and improve well-being, but we're also reducing anxiety and depressive symptoms. So we started this intervention, we kind of piloted it a few years ago, and I'm not sure how well you can see here on this graph, but we showed that participating in this intervention promoted resilience, and it also decreased depressive symptoms. So seemed to be promising, and the NIH now funded a large trial, a randomized controlled trial, where we are testing this out in 200 couples. I wanted to give an enrollment update. Just as part of my update, we actually had a delay in starting the actual intervention portion or the study portion, mainly due to staffing issues. So we experienced some of these as well. But I wanted to show here that, pretty small, huh? But we currently have 41 couples enrolled, and we are, if we continue along this trajectory, we will meet our enrollment goal by the end of the 5-year study. I'm really proud of what we're able to accomplish with this. We have a lot of retention, so the people who get into the study, they stay in, they participate in the activities, and we get some really positive feedback. I'll share some of the findings with you here in just a minute. But I also wanted to show you this because we have lots of room still. We need more participants. We need more couples to participate. Please refer them our way. Okay, that's my plug. So what does this intervention look like? I mentioned that it was a remotely administered program, and so what we do is we mail out these booklets. So it's actually a physical booklet that we mail out. And it's this 8-week, we call it a journey, where our participating couples go through different kinds of modules. We start out with reimagining us in the context of stroke, where we do some psychoeducation on some of the effects that we see that stroke can have on relationships. Then we go into prioritizing and planning. This is where we set SMART goals. Anyone SMART goals? Yes, we just learned about how important those are, right, to keeping our patients motivated. Self-care, this is also stress and management issues and kind of managing emotions a little bit. Let's talk about it, communication challenges and strategies, which we also heard addressed a little bit earlier. And then connecting with yourself, finding meaning and purpose. So this is rediscovering activities or discovering new activities. And actually, you'll hear me talk again later this afternoon on one way to do this through adaptive recreation. There's a little tease, right? Preview. And then connecting with each other, connecting with others, and then looking to the future where we have them set new goals after the program is done. We have, for each of the weeks that they go through, we have them do these activities that are based in positive psychology. So they are really sort of focused on this, building resources and building on resources and strengths. And the one I want to kind of focus on for this particular presentation is this fostering relationships one, which is making time for people and being supportive. So now we get to see whether I can make this work. I might need some help. But we have our participating couples both do activities with each other, so as a couple, as well as with others outside of the relationship.
Relationships. There are many kinds of relationships in our lives, and each is important to our health and happiness. Relationships act as a buffer to protect us against stress. Good relationships help us feel loved, heard, and give us a greater sense of belonging. They provide a support system that you can rely on. Supportive relationships have been shown to make you healthier and better able to deal with life's challenges. Here are some examples of activities to foster relationships. Make time for all your relationships, including your partner, friends, and family members. Reach out to people over the phone or set up a video call. Make plans with friends for dinner nights or any other gathering you all enjoy. Set aside or turn off your gadgets. Be open to listening, being supportive, and showing interest in other people. Open up, show affection, and express appreciation for those around you.
So as part of the program for each of the weeks, we have created these videos. So we have a different video for each of the weeks, and they access that through these little QR codes. If they're using the booklet, we also send them a PDF version if they want to use it that way. But I want to talk a little bit more specifically about the reconnecting with each other and then also reconnecting with others piece. So really one of the main drivers for creating this program was because I saw such a need for finding better ways to support couples. This is not, and I will say this again at the end, this is not intended to be like a couples therapy. That's not what this is. This is more of, we're providing education and support and, some sort of structure, scaffolding to help couples sort of rediscover and reconnect activities they used to enjoy together, things they like to do, and with the idea that this will then build resilience. But a lot of the things, I put on this slide are things that we hear about, or that patients and their partners would tell us when they're coming in for therapies. I worry I will have another stroke. Then this is more specific to the romantic relationship. I feel unattractive. I feel like a burden. I feel like I'm being treated like a child. I worry you will have another stroke. I'm overwhelmed. I feel like a parent, not a partner. And so it's very clear in hearing these comments that there's something that changes in the relationship, and unfortunately that's usually not addressed as part of typical rehabilitation therapies. This might look a little bit familiar because I presented something very similar last year, but I wanted to reiterate that there are relationship changes that happen as a result of the stroke. In the beginning, very appropriately so, there is a focus on the care and rehabilitation, right? There's nothing wrong with that. I'm not trying to suggest that. But over time, and as a result of this, what we sometimes see is that the roles shift from a romantic, partnered relationship into something that's more of a caregiver-patient relationship, and these new roles are often dissonant with the romantic roles. There can also be a sense of a loss of companionship and mutual support that makes partnerships what they are. And unfortunately, what we see is that the effect of this is often not positive. About half of stroke survivors report that there's a negative change in their relationship since the stroke. Relationship harmony deteriorates, depression increases in the first 3 years post-stroke. So these are not great. But I want to emphasize that it's not all bad. In a needs assessment that we did prior to actually launching or developing this program, we had surveyed both survivors and partners, and yes, about 40% said that they feel like they had a decrease in their relationship satisfaction, but just as many reported that they actually thought the relationship got better and stronger. And things like reevaluating priorities, being grateful for your partner, having a strengthened sense of commitment, like those are all things that contributed to greater relationship satisfaction. The other thing that we saw is that in those who felt like their relationship was not as strong or not as satisfying, it was often the case that they felt like they're just not really sharing in activities anymore. They're not really sharing time together, doing things together. And one thing that I think is really important is sort of this idea of redefining the relationship. I was just had a conversation earlier this morning about, I think oftentimes what we see is that for both the person who had the stroke and their family members or their partners, they kind of think about recovery as, okay, it's going to be just like it was before the stroke, right? That's sort of what I'm going to get to. And anything that falls short of that is not satisfactory. And unfortunately, that's not something that we can always guarantee, right? And I would actually argue that in the vast majority of cases, if not all cases, things will never be the same. They're not the same person they were before the stroke, and neither is their partner, because they've gone through a life-altering event, right? So you might regain all of the physical function, cognitive function, emotional function, but you have had an experience that has changed your life, and because of that, I would argue that things are just never going to be the same. And so redefining kind of who you are, what the relationship looks like, and what recovery or recovered really means is really, really important to kind of get couples or partners on the same page. One of the ways to really do that is fostering mutuality, or it's this idea that you have these shared experiences, shared respect. You are kind of grateful for each other. That can be, or is typically associated with, having more relationship satisfaction and doing better, coping better with the changes that are coming or that have happened. I could do an entire talk on sex and intimacy after stroke, and I have, and I'm happy to do it in the future if y'all will have me back. But one thing that we actually heard a lot when we were when we did our pilot study, we interviewed each and every one of our 34 couples to ask them how things were for them, things they really wanted to see more of. And time again, we would hear, well, really, we would love for someone to address sex and intimacy with us better. This is completely ignored as part of our recovery, or I don't feel comfortable bringing it up, right, to my doctors or to my therapists. And so this is something that we also addressed in our modules, but I wanted to kind of highlight this because I do feel like we should all be on the same page when it comes to addressing this as part of our patient care. Intimacy, just as a note, is the feeling of being close, emotionally connected, and supported. It may or may not be sexual, right? And can involve touch, words, or both. What is the most important organ for sex and intimacy? The brain, yes. Spoiler alert, right? So it's no wonder then that if you have an insult to the brain, like we see in a stroke, that, both sexual functioning and things that kind of make intimacy happen are changed. That goes together with some of the other physical effects. Thinking about incontinence, for example, like that's always a big worry. Emotional adjustment, cognitive impairment, that's always a big question mark. When is it, appropriate? When is it problematic? But it's something that we should be addressing, and we should encourage patients and their partners to talk about it, or at least bring it up so they know it's okay to talk about this. It's a normal thing to talk about, and if we're talking to our patients and their partners, that this is likely something they have been dealing with or thinking about and might be unsure about. One way to really rebuild kind of the sense of intimacy is through activities, right? So rediscovering activities to do together can be a powerful way to connect with each other. And so I provided this is directly from our booklet, and you should have access to this on the presentation once it becomes available. But I just wanted to give a sampling of some of the activities that we have that really, help our participating couples kind of come up with ideas and do some of these things together. So we have, get to know your partner, take online quizzes together, learn something new together, read or watch something informative, create music playlists together. I don't know if anyone here besides me is old enough to remember mixed tapes, but yes, they are a thing. We can still do them. Incorporating physical touch into your daily routine with your partner, hold hands with your partner while going for a walk, while watching TV, or before falling asleep. And so I'm actually really proud of some of we have lots and lots and lots of activity examples for our participating couples, and I'm really proud of kind of how we came up with these, in that we did generate ideas with stroke survivors, their partners. We had a list of activities, and then I had some of our OT students in our program adapt them so we have activities that kind of run the gamut, right, from things that could be done by someone who has more significant impairment as opposed to someone who does not. So we try to make it as accessible as possible. We also include information on how to maybe start conversations about sex and intimacy with your partner. So there's I hope, I want, I need worksheet that some of you might be familiar with, but I'm hoping these links will work for you out of the PDFs, and if not, let me know. You can shoot me an email and I'm happy to share those with you. I did mention that I was going to talk a little bit about some of the things we found as part of this study. Because we kind of had a slower ramp up and are just now getting caught up with our recruitment, we don't have a ton of data, like quantitative data yet. That said, I was very excited when we had our first 2 couples who were enrolled. They just finished their last assessment, so we're getting there. But I was able to pull some quotes and things that participants are saying about the study. Now, if you were here last year, and I do recognize some faces in the crowd, you might recognize these quotes. These are actually from our pilot study, and these are some of my all-time favorite quotes, so I had to include them again just in case you didn't see them last year. But we had someone say, "It helped me realize," it meaning the program, "it helped me realize I could enjoy spending time with my spouse, not just someone I take care of. Feels more like what couples would do as opposed to just feeling like I'm a caretaker, which is something that I've struggled with." And then from a stroke survivor, he was more empathetic. So the study has some real value, us thinking about it as a couple, not just me in my bubble of strokedom, but as a couple. In the current study, we don't just send them out these little booklets and have them be on their merry way. We actually check in with our participants weekly to see how things are going. We also ask them to fill out some surveys and just give us some feedback on how things are going. And so these are just a little smattering of things people have said. Taking one day at a time and learning the new me. The program is helping me realize how important it is to stay focused on the positive and being grateful for what we do have. We communicate more openly without emotions getting in the way, letting each other be heard, not hurt. I would like to get that framed. My partner who suffered the stroke, we have been able to start communicating again without getting upset or misunderstood, and it was so lovely to have that piece of the past back. Okay, so reconnecting with the others is the other piece that I wanted to cover, which is kind of thinking outside of just the couple and going to the broader network. As I mentioned before, stroke can make it really hard to keep strong, supportive connections for both partners for various reasons, but they're so important to health and happiness. Social relationships make us feel loved, cared for, valued and protect against the negative effects of stress. And they also give us a sense of belonging and can provide us with a fundamental purpose to life, which is also really important. Again, I included some activities here. So we have some activities that they can try by themselves, so reaching out to a friend or relative and schedule a phone or video call. Research social groups you want to join. These can be online or in person. You can join book clubs, right? And then we also have some kind of more introspective activities. Make a list of people in your life that you feel the most supported and most loved by, and then going out and actually telling them how you feel about them. And then we have some joint activities that they can do. So research volunteer work, doing some volunteer opportunities, go through your closet and storage space together, donate clothes, food, or items you no longer use. Offer to complete a chore for a friend or a neighbor. And these are kind of organized around this idea of acts of kindness. So I don't know if you remember from earlier, but we kind of have these categories of activities, and these would fall under acts of kindness. And so a few more quotes from participants about some of the things they've experienced outside of the couple as a result of participating or during participation. So this is on the weekly check-ins that they do. Grandkids came over for sleepover first time since her stroke. Everything was nice. Had some friends over, and I really enjoyed the time. Taking time to connect with friends and family in a listening, caring way. Shared this week's challenge with a family member. It opened up a great discussion. I have had some very meaningful exchanges with family members. Okay, so what can we take from this to apply to practice, or things we can incorporate into practice? I hope I'm making the point abundantly clear that it's really important for us to consider the couple as part of our rehabilitation, but also thinking outside of that to the greater support network. Providing psychoeducation, making sure that partners especially are on the same page, but I would also say we want to expand that to the broader family members or people who are helping to care for the person who had the stroke, making sure we understand some of the symptoms we're seeing, some of the sequelae we're seeing, talking about recovery, making a referral to specifically address the relationship if that is in fact an issue. And then recommending support groups for both the stroke survivors and their partners can be useful. And those can be virtual or in person, whatever makes sense. And then, of course, encourage partners to engage or re-engage in meaningful activities on their own, together as a couple, or also thinking beyond the couple. And this might mean finding new activities and or finding new ways to do things that they used to enjoy. So again, I'll talk a little bit more about that at my talk this afternoon. And with that, I kind of want to circle back to our restored study and give you a little bit more information in case you are interested in providing this as a potential resource for your patients and their partners. So again, this is an 8-week program. We do have assessments that happen at weeks 1, 8, 16, and 40. So if you don't want to do the math, that's a 6-month follow-up. So it is quite a commitment. And so when I say that our participants who enroll, that they've been sticking with it, that they're engaging with it, it's kind of saying a lot because it does take quite a bit of commitment. All participation is remote. Everything they do happens online by phone or mail. And we provide gift cards. To be included, we include couples that are 3 months to 3 years out from their most recent stroke. It's okay if they've had multiple strokes. We just want it to be from the most recent stroke. They must have a romantic partner. They're living together. And both partners must be willing to participate. So that's kind of a critical point because this is a dyadic intervention. And at this point, we are only offering it in English, so they must be able to read and follow instructions in English, but we're working on some alternate options there. We do have an exclusion criteria for significant cognitive impairment or aphasia, just meaning that they're not able to provide their own consent. So we do need for both partners to be able to provide their own consent to participate. But I also want to emphasize that mild to moderate cognitive impairment or expressive aphasia is totally okay. So I don't want to, I don't want you to kind of think about like, oh, well, this person has some cognitive impairment. I don't know if they'll be able to do this. Refer them to us. We'll screen them. We'll figure out whether their participation would be appropriate or beneficial. Enrolling in other studies is okay on our end. So if they're doing something else, that's totally fine with us. And again, this is not couples therapy. It's a program that's intended to foster resilience in partners and hopefully by default then also within the relationship. So I have a bunch of flyers and some other items, like some pens, magnets, and some squishy hearts. I'm hoping some of you are picking some of those up. They're out there. I don't want to take them back home, so please take them. What happens, or how would you maybe refer someone to us? So really the easiest way is to either have them or you scan the QR code, and you can just enter the information in there directly. And we will then be able to contact them. It's just like it's not even a screening form. It's just an interest form, right? They're indicating they might be interested in learning more about the study. We'll contact them, and then we'll enroll them. They're going to be randomized to either receive the intervention right away, or they will be waitlisted, meaning they have to wait for 8 weeks. But everyone gets to participate. It's just a matter of when. And with that, I want to thank you for your attention, and our participant couples, of course, my collaborators, my awesome project coordinator, who is not just incredibly competent at what she does, but also just a really good human being, which goes a long way when you're talking with couples who are struggling, and of course, my funders. And then I have questions. Time for questions and comments? Yes, we have time for questions and comments.
I was just wondering, is there a role? I heard you talk about OT students just for a second. Is there a role you use students for in this project? And what is it?
Absolutely. So the question is whether there is a role that we use OT students for. So in our program, we've created a research elective, so they can do kind of an elective. And we've created a research elective where they can participate and actively do research with some of the faculty who are doing research. I also have, because of my funding, I also have research assistantships that our OT students can engage in or take advantage of, where they're paid assistantships, both for tuition benefit as well as just hourly. So typically what we do is we kind of have them participate in the elective first, and then do all the training and see if they like it, and then we have them transition to a paid position. But really what they do as part of the project, in the early phases when we were developing them, we had them help with things like gathering the resources. Like if you're interested in looking at the booklet, I brought a copy, but it has tons of resources in there that are linked to other websites. A lot of course, like the American Heart and Stroke Association resources are linked through there. But they kind of compiled those, and they helped script the videos that we created. So they were involved in a lot of the development, and now that we're in the data collection phase, they do anything from recruitment, screening, to following participants. Yeah, they're involved at every stage. It's wonderful to have students be able to participate like that.